Hi, good evening, class. My name is Christopher King, as most of you know, and this is my presentation on my chosen population, which is the older adult population. So let's get started, shall we? So as an introduction, I decided to include a little blurb from last week's discussion just to introduce why this is pertinent to social workers, or work with this population is pertinent to social workers, especially moving forward. So advanced age individuals made up a larger portion of the population in the 2010 US Census than in any prior US Census, and increased at a faster rate than the total US population. What this means is that the rapid growth is expected to continue, and the number of individuals 85 and older is expected to more than double by 2030. This circumstance is set to be a significant issue in social work, as there is already a severe shortage of healthcare professionals specifically trained to provide care to this population, which I'll get into a little bit later. Social workers will be needed to assist individuals within this population in locating affordable housing, um, as well as access to transportation and finding more appropriate healthcare in the respective local areas. As would be expected, growth in the public health and medical sectors of social work, because of this dynamic that we're currently seeing with the aging of our population, is expected to be more rapid when compared to other occupations at a projected 22% growth, which is good news for those of us who seek and desire to work with this population in this setting. So some specifics about working with this population. So first and foremost, obviously, is going to be aging. Aging is probably going to be the number one thing on the list, just because it bleeds into so many other things like disease, and the degradation of certain abilities due to dealing with long-term and chronic disease, which I will get into. So just from the top, chronic disease conditions and short and long-term disability are more likely in the older adult population, per our textbook. Increases in complications include many things, but just to name an example, it can be caused by polypharmacy, which is where the medications, you're taking so many medications prescribed by the doctor that they begin to interact and mimic the symptoms of other diseases or disorders, and just the interaction is an issue in itself, just because you're taking so many medications. So this becomes especially important when we're attempting to complete differential assessment or differential diagnosis even, and trying to differentiate between something like dementia or a reaction between a sleeping medication and a blood pressure medicine. Additionally, due to the degenerative effects of aging, this population is much more vulnerable to abuse, which I'll get into, disease, poverty, and injury. And speaking of injury, approximately 85% of proximal humeral fractures, which is this part of the arm, occur in individuals in this population. Individuals specifically who are older than age 55, and the gender distribution indicates that women are twice as likely as men to have this particular injury. So I think what that all boils down to is it's safe to assume that aging means that older adults require a little bit more care than someone who's a little bit younger. In assessment, we find just that actually, and the fact that you need something like a comprehensive geriatric assessment, something that's standardized and a little bit more thorough when it comes to assessment, and that's based on the assumption that older adults experience declines in multiple domains simultaneously, and so it's a little bit harder to suss out what their needs actually are. So there are different forms of comprehensive geriatric assessments, some a little bit more detailed than others, such as the Geriatric Resources for Assessment and Care of Elders, which is the best acronym ever. It's GRACE. That's the best acronym when you're dealing with the older population. Which additionally seeks to assess domains such as the patient's physical environment, the competency of the family caregivers, if that's applicable, their ability to perform activities of daily living, or ADLs. That acronym is important later. But ADLs are just things like cooking, cleaning, shopping. So it really seeks to perform a very thorough and standardized, which is important, assessment of an individual who is a part of the older adult population, just to make sure that we are assessing the needs effectively, validly, and appropriately. So getting into the major challenges. One major challenge faced by this population is financial issues. 43% of single recipients on Social Security who are ages 65 and older, so within my children population, depend on Social Security for 90% or more of their monthly income, and older adults on Supplemental Social Security income, SSI, receive an average of just $435 each month, which is not much to say the least. So financial issues sort of bleed out into other domains within the life of an older individual, including finding appropriate, affordable healthcare, safe housing, and transportation, which we've already discussed is one of the major barriers to treatment for older individuals. So that's the reason I chose this as one of the major challenges. It just bleeds out into so many other domains of an older individual's life. And the second major challenge that I chose was living with chronic illness or disease. As aging occurs and health deteriorates, whether it is prolonged or sudden, illness and or disease has a primary impact on physical fitness. And that was the main impact that I saw in my research as far as this being a major challenge for the older adult population, simply because physical fitness determines so much. We sort of take it for granted as younger individuals, but it can impact your ability to even take care of yourself on a daily basis or complete those ADLs or activities of daily living. So when you have a deterioration of your physical fitness due to the results of living with a chronic illness or disease, you are limited in your ability to get about. You become less ambulatory. Some people cannot even complete tasks for themselves, such as dressing, cleaning, feeding themselves. So that has the potential to make them more dependent on caregivers, which makes this population more vulnerable to things such as abuse, which I'll get into in just a moment. An interesting fact that I found was the fact that there's already a shortage of geriatricians who are specialized or specifically trained to work, physicians that are specifically trained to work with this population. There is a current demonstrated need for at least 20,000 geriatricians in this country, and we currently have 7,300 practicing nationwide. So ultimately, I believe it's safe to say that finding a qualified doctor clearly presents a challenge or an issue for this population, and that also stems from living with chronic illness or disease. Okay. I feel I would be remiss if I did not mention the fact that this is considered a vulnerable population. Therefore, they are a little bit more vulnerable to things such as abuse, specifically because of the things I was just talking about. They lose some of their function and ability to get around or perform activities for themselves, and so they depend on care workers. So that opens them up into all sorts of abuse. And I don't really have time to go over everything on the slide, but I figured I'd just present these interesting informations or these interesting statistics and some interesting information that sort of elaborates on the different types of abuse that this population can potentially see. Just as a side note, social workers are mandated reporters in most states. Therefore, if we ever suspect abuse in a vulnerable population, including advanced age individuals, then we are reporting that as mandatory. So you would report that to the appropriate authority. There is a National Center on Elder Abuse hotline. There's also an Adult Protective Services hotline that you can call if you ever suspect abuse associated with anybody in this population. And this is sort of how I conceptualize everything fitting together. I know I'm doing the most, as we say, but aging spills out into basically every domain in an older individual's life. So you start with aging, which spills out into living with and adjusting to chronic illness, disease, and or injury. The book states that the older we get, the more likely it is that we have some sort of illness or chronic injury, which spills out into physiological deficiency and or impairment in physical fitness, which bleeds over into reduction in independence and ability to perform activities of daily living, which causes financial strain and issues just because of the diminishment of economic resources due to the fact that it can't get around like it used to, which leads into a reduction in independence and potential dependence, isolation, and increase in chronic stress, which leads back into increased aging. It's like a big depressive cycle if not intervened on or treated appropriately. And I'm actually running out of time. So just to run through preparing for collaborative work with this population, I broke it down into two general parts And those parts include building competence and employing empathy. Building competence includes things that I would need specifically to work with this population. So those include some sort of practical experience with a comprehensive geriatric assessment, understanding of team dynamics, since I will most likely be working on a multidisciplinary or a transdisciplinary team, utilizing effective communication skills and communicating with the team, as well as the patient and their families, developing a better understanding of resources made available to this population, and then utilizing research to inform the way that I practice with these individuals. And then the second part is employing empathy, and that's just understanding the unique situation where somebody comes from, maintaining respect for the dignity and worth of a person regardless of their circumstance when they come into contact with you, and then recognizing factors which have the largest and most effective impact on an individual's quality of life. Required resources for me, for this population, would include working with some sort of standardized form of assessment. I say standardized, and I place importance on that just because I think it's important that you use a consistent measure to assess, especially individuals in this population, just because it provides an accurate assessment. And if you do it multiple times, you can accurately and validly track change over time because you're using the same standardized form of assessment for that population. And then if I'm to work collaboratively with a team, I'd prefer to work with a team that meets on a regular basis and everybody comes to that meeting on a regular basis. I say that based on experience. And I just want to ensure that everybody on the team is on the same page as far as care coordination, or just care for the consumer is concerned. Resources for the client in this situation are specific to the challenges. So financial hardship, I think I will need to develop and maintain a knowledge of the social services programs designed to address this particular challenge for this population. And I need to be effective in assessing the way that my client fits into the needs-based calculations for those particular resources. But it all starts with developing a knowledge of those resources first and foremost. And then associated with chronic disease, I think the consumer requires a research-informed social worker or team who can effectively communicate not only pertinent health information for them, but also benefits and risks of any chosen health interventions. And that all comes along with being an effective communicator. What a social worker can offer in this situation. What a social worker can offer in this situation specifically that not other professions necessarily can. So encouragement of collaboration with consumer to inform, guide, and best plan for intervention approaches is something that we're trained in. Additionally, social workers have developed an understanding of the importance of both social and cultural context to human behavior, therapeutic impact, and outcomes. Also, social workers have the ability to utilize a range of theories and perspectives to address issues with the consumer. As an example, if I'm working with an older adult client who is suffering from depression, before assessing and addressing this issue as a deficiency of the brain or body, as a nurse or a physician might, an effective social worker can perform an assessment utilizing a systems perspective, a strengths-based perspective, Erikson's theory of psychosocial development, in realizing what life stage they're in and how the challenge of that life stage comes into play with their depression, and any other portion of the theoretical background expected of an effective social worker. So we're expected to be theoretically eclectic, or to employ theoretical eclecticism to work out ways to best assist our client. What that boils down to for me is I believe social workers can utilize such a wide array of options and fit into so many different healthcare settings because we are trained to be effective communicators who adjust their theoretical knowledge and practice to fit a certain client's presenting problem while focusing on increasing a consumer's access to needed social and financial resources. We understand that client empowerment can be impacted via the way the client thinks and feels about themselves, via the client's relationship to and with others, and then via client interactions with larger systems present in their environment. And all that boils down to the person that's sitting in front of you who requires your help, in essence. So this is my question to the class, and I'll include this in my discussion post as was requested. And I made it to my reference section. satisfying that requirement. So I realized this was a plethora of information on this population, but I appreciate your time and thank you so much for listening. I hope you guys enjoy the rest of your night and good luck with this class and the rest of your classes.